I'm Rachel, and this is Kaylin. We chose to do our tech talk on the Abilex oral motor exerciser. All right, so why would someone choose this device? It was designed to help improve swallowing function and oral control. Exercise therapy with the Abilex device is intended to build strength and coordination of the tongue and lips, while the unique design of it provides oral awareness and enables safe practice of swallow skills. The device is designed to put patients in control with an engaging device to support exercise independence and motivation, whether they're at home or in the hospital. It supports daily independent therapy sessions in between their visits with the SLP, and it also increases inpatient therapy time without increasing the workload of the SLP, which is always a good thing. And then it's been proven that more therapy time has shown to improve rehabilitation of functional communication measures. So these are like the 5 components that the company focuses on with the device since it's multifunctional. So first is the tongue and lip strength. The isometric resistance-based exercises are designed to build strength. The tongue strengthening has been shown to improve functional swallowing, reduce aspiration, and improve quality of life. Next, you have tongue control. The movement-based exercises are designed to get patients manipulating their tongue to improve control, coordination, range of motion, and flexibility. Next, you have oral awareness. The tactile feedback of the device provides sensory stimulation to encourage oral motor awareness. And then you have swallowing skills. It stimulates a ball of food in the mouth to support safe practice of their swallow skills. And then lastly is the brain activation. Physical therapy following an injury is important in promoting neuroplasticity, the development of new neural pathways in the brain. So, how much is this device? The total cost that we found was about $29.95, and that is purchased directly from the website. That was the best price we found on like all platforms. And then you can also, like hospitals and private clinics can purchase them in bulk. It did not give us that price. It looks like you just reach out to like the coordinator with the company to get that set up. When you do purchase the device, it comes with the storage case, which is always nice. And you also get a 30-day warranty. I think that's just for like the materials and the workmanship of it. All right, so it's very easy to use. If you see the image on the right-hand side of your screen, that's just a reference for size. It was made from medical grade silicone rubber, and then it has not been manufactured with any latex, so you don't have to worry about any of your patients having allergies to latex. All right, so who is this appropriate for? Clients that may benefit from the implementation of Abilex during therapy include those diagnosed with any of the following: dysphagia, brain or spinal cord injury, head and neck cancer, Parkinson's, cerebral palsy, intubation, dysarthria, apraxia, and tongue thrust. Why would it be appropriate for them? So this device can be used from early intervention to home-based care. It's safely designed to support early intervention, which may improve time to oral feeding. And then it's easy to understand the tasks that you can do with this device. It's easy to understand, and they're engaging, and they're easy to follow, which is important for a lot of our patients, especially our brain and spinal cord injury patients. You start with the simple oral awareness exercises, and then you work up to the full program. And then the exercises that they learn while in your care, they're easily transitioned to when they go home.
Okay, so now we're going to look at the role of the e-helper with Abilex. So how to assist in oral exercises. This will be a handout that we would give to the e-helper for each patient. And this would be given to them prior to the client using it in therapy. And this would allow for them to become more familiar with the motions that are required for each exercise. And it also provides them with a step-by-step breakdown of each exercise that the SLP can have them work on to target the client's specific goals. So we're going to take a look at a video, and it's really great for the eHelper to go back and reference this also, and it will help explain to you all a little bit more about what this specific device does.
Abilex device therapy is designed to support your oral rehabilitation based on existing treatments. 4 exercises were developed by speech-language pathologists to safely stimulate and exercise parts of your oral cavity and target key aspects of swallowing and oral control. The lip press and pull is intended to strengthen and improve lip control for proper lip seal and coordination. To start, tightly press your lips around the tether of the Abilex, keeping the bulb firmly inside the mouth using only the lips. Once the tether and bulb are comfortably in position, gently pull on the Abilex handle while pressing your lips as tightly as possible to hold the bulb in your mouth. Pull for 3 to 5 seconds, then relax your mouth to a comfortable resting position. Repeat this exercise for a total of 5 times. The tongue push-up is designed to strengthen your tongue and work dorsal elevation. Start the push-up by placing the bulb on the forward part of your tongue. While keeping the handle of the Abilex device horizontal and using only your tongue, press the bulb against the roof of your mouth. Hold the bulb there for 3 to 5 seconds before relaxing your tongue to a comfortable resting position. This exercise should be repeated 4 more times. The bulb side-to-side exercise is intended to strengthen and improve coordination of lateral, side-to-side tongue movements to help you with control and range of motion. Place the bulb of the Abilex device on the center of your tongue. Then, using only your tongue, push the bulb from the center of the mouth towards your left cheek and hold the bulb there for 3 to 5 seconds. The handle should remain straight. Relax your tongue to a comfortable resting position, then repeat this exercise for a total of 5 times. Once that set is complete, perform the same action with your tongue by pushing the bulb of the Abilex from the center of your mouth towards the right cheek, again using only your tongue. After holding the bulb in place for 3 to 5 seconds, relax. This exercise should be repeated a total of 5 times on each side of the mouth. The bulb front to back exercise is designed to support coordination and control of your tongue, to aid you in forming a ball of food and moving it to the back of your mouth for swallowing. Place the bulb of the Abilex device on the center of your tongue. Then, using only your tongue, push the bulb against the roof of your mouth, creating a slight suction. With the bulb pressed against the roof of your mouth, use your tongue to move the bulb forward towards the front of your mouth, and then backwards 5 times. Relax your tongue to a comfortable resting position before repeating the exercise for a total of 5 sets. Speech-language pathologists recommend that you work towards accomplishing 3 sets of each suggested exercise 3 times per day.
Okay, so as you can see, this is not really a technical device, but this would be a great tool to use in teletherapy for speech language pathologists that are unable to see their patients that have dysphagia, for example, in the clinic each day. So, or during the week due to COVID right now, or if they can't travel from facility to facility, like a lot of speech therapists do that are PRN, you could still see your clients over telepractice with e-helpers within the facility that they're living at. So that's why we thought this would be a really good one to do. So here's our clinical scenario and our ethical concern. So we have Sally, who is a single 58-year-old who has recently been diagnosed with dysphagia following a CVA. Sally is highly motivated and wants to improve her swallowing and reduce her intake of thickened liquids. However, following her CVA, Sally does experience confusion regarding time and has struggled to remember the days and times of her teletherapy. She's also struggled with keeping track of which exercises she has completed each day and the frequency. Sally does have an e-helper. However, this person that has been hired by an agency to provide her with assistance often states that she also forgets some days to remind Sally to log into her sessions and does not always remember to track her exercises or correct Sally. So, to solve this possible ethical concern, Contact to Sally's family or and or the agency by the SLP will be required to provide additional education to her hired caregiver on understanding the importance of adequately supporting Sally during this crucial time of recovery from her CVA. Explaining and providing education on how the device will help to improve her dysphagia would also be needed to ensure that the caregiver understands that the treatment plan or the plan of care must be followed with fidelity. A laminated or whiteboard type weekly checklist may also be beneficial in keeping track of when Sally completes her exercises that you just watched in the video, and provide a space to write down like when her teletherapy sessions are, would be another way that we would solve this problem. And we would also definitely reference back to the video over and over to make sure that the e-helper understands how to correct Sally and what she should be looking for each time that she completes the set of exercises that would be in her plan of care. So some variables to consider. So some of the barriers to this device is that it's something else that would have to be purchased and the patient would have to keep track of it. And having confidence that the client is doing exercises correctly without SLP supervision and not developing bad habits. So like we said, the e-helper would definitely need to be trained on how to properly utilize this device, or else it's not going to be effective. Some of the benefits, though, is that it provides the ability to independently practice and transition from in care to at home. So, what they learn in the clinic or in the setting with you individually, the SLP, the patient's able to take that home, and it promotes really good carryover. And it's very easy to check on the patient progress through telehealth because they can pull out their device, they can work through the exercises, and then you, the therapist, can see what they're doing. And it's a really great, affordable tool for anyone that is seeking oral rehab through speech therapy. We absolutely love this device, and a lot of the research you can look up later on your own really speaks volumes about it. And also, there are free continuing education webinars now available, so you can earn ASHA CEUs after we graduate. Be something that you all can look at. And it really does enhance therapy outcomes. There's a lot of research on the website itself that we've linked below, and you can check that out and read it for yourself. And here's our references. Thank you all so much for taking the time to review our presentation.